For National EMS Week, Pikeville Medical Center is highlighting their EMS services for children and how they care for young patients from the ambulance to the hospital bed. The general decline of EMS service quality in the region is what led PMC to seek improvement in that department. Executive Director of Emergency Services Dale Morton gives us more details.
Just because we're in such a rural area and EMS services is declining in this area, so that was one of the things that helped guide us into getting our own ambulance license and work. So what we do now, if we have a child that we have to transport out to another facility, which very seldom happens, but when it does, we want to be ready. So we have our service ready. It's on standby. If our truck is already on the road, then we utilize the other outside agencies to get those children and patients transported in the most expeditious manner possible.
When working traffic across Kentucky, responding to crashes involving deaths or injuries is the toughest part of our job.
When you drive, there is so much out of your control.
What you do have control over is wearing your seatbelt. Please always buckle up.
PMC is also currently working to get all of their ambulance personnel pediatric readiness certified starting next year. They're taking necessary steps in order to put both young patients and parents at ease.
We are one of the few hospitals in Kentucky that have the certification of pediatric readiness, and we are currently working with our EMS people to get them the courses and training that they need so that our ambulance, hopefully come January, will be able to obtain that same certification as pediatric ready, which will really help us. The other certification that we've got in the emergency department and also in our Metro Children's Hospital that really is a great bonus to us is we are certified as autism ready. It's just so comforting to know, for us to know that, when we get a really sick child in here that needs to go to UK or Cincinnati Children or somewhere, that we've got the personnel and the equipment here to get that patient there in a timely manner. That means so much to the parents. It allows us to use these to transport the parents so that they're not having to be separated, and just makes for an all the way around better process.
Reporting for Mountaintop News, I'm Nick Collum.